Let's look at otitis externa from chapter 85. Otitis externa is a cellulitis of the external auditory canal that may extend to the auricle or the pinna of the ear. It's often referred to as swimmer's ear, but that's a little bit of a misnomer because there's several causes of otitis externa. Epidemiologically, about 1 in 125 people will develop otitis externa annually. It occurs mainly in warm months and in high humidity. Chronic otitis externa affects about 3 to 5% of the general population. And unfortunately, there's a small percent of people who will progress to malignant otitis externa or necrotizing otitis externa. And this generally is found in patients that are immunocompromised or have comorbidities. The pathogenesis of otitis externa is really related to risk factors that compromise the integrity of the canal. There could be damaged skin, maceration from water, wearing earplugs or earbuds. In about 90% of the cases, we do know they're bacterial, so look for the two most prevalent pathogens of Pseudomonas or Staphylococcus. Fungus is uncommon in acute otitis externa, but it does need to be considered if we've got a recurrent otitis externa in our patient. Pain, clinical presentation, pain of the affected ear and auricle, usually within 48 hours of the infection. There's a feeling of fullness and itching, drainage from the ear and hearing loss, and chronic otitis externa symptoms are very different than acute otitis. These patients generally just present with intense itching or pruritus. So the physical exam, you would expect pain and tenderness on palpation of the tragus and repositioning the auricle, so it's difficult to be able to look into the canal because it creates pain. There's erythema and edema, and sometimes just that obstruction disallows evaluation. But when you can see, the canal is usually filled with debris. The tympanic membrane might be erythemic or even difficult to visualize. And sometimes there is complete obstruction. Cellulitis may extend to the external ear, and when it does, you're going to find a positive lymphadenopathy. There are hearing deficits, and again, that chronic presentation is different. Usually the canal is dry, cerumen's absent. There's usually evidence of excoriation from scratching. Discharge can be present, and the canal is usually narrowed by thickened canal walls, but not edema. That's from that persistent chronic inflammatory response. Diagnostically, it's usually through physical exam and history. Usually you don't need any testing. It's not necessary, but you can culture for CNS if no improvement after 14 days. Also, don't negate the benefit of a wet prep. KOH may identify any fungal cause. So management and treatment really is important to clean the debris, manage the pain, and treat the infection. Topical antibiotics for canal infections are usually adequate. They cover both. You want to choose one that covers both Pseudomonas and Staphylococcus, and those are most frequently found in the fluoroquinolone category. Systemic antibiotics for infection extending outside to the ear are sometimes necessary. When do we refer? Well, severe malignant otitis externa can be life-threatening, so it requires an immediate referral to an otolaryngologist for possible hospitalization, and I'd say for probable. Patients at risk for malignant otitis externa may benefit for referral. So, in the light of having one, that's one thing, but even if you, in your consideration and your clinical reasoning, think this patient is at risk, please make that referral. So what do we need to do? We need to educate our patient about the causes, management, and prevention. We need to teach eardrop administration and how to do it correctly. We need to teach our patients to expect improvement in 48 to 72 hours or to return for reassessment. They should expect resolution in 7 to 10 days. And then finally, we need to include instruction prevention techniques such as no Q-tips. And after swimming, we can care for the canals with some products that contain alcohol and saline. And there is some swimmer ear eardrops, and what they're doing is they dry the canal. Even just using gravity and allowing your ear to drain. Earplugs also can be used with swimming, but they also carry some risk, but a lot of people do use them. Thank you.